Good morning, everybody. Welcome. We are going to present to you a package today of legislation dealing with childhood lead poisoning, a totally preventable childhood disease that we need to address here in Minnesota. It's totally preventable, and yet we have more than 700 children every year in Minnesota needing treatment for childhood lead poisoning, and perhaps more. There's going to be a couple of bills we'll talk about, and I'll mention mine first. This bill could basically be called the renter's right to know about toxic lead exposure in their homes, renters and prospective home buyers. Right now, Minnesota state law has a gap in disclosure about toxic lead. So if you are a renter or a home buyer, you have no statutory right to know whether or not there's a lead hazard in that house today under existing law. You only have the right to know if the property owner has already tested for it. So this bill says that they must test for it and they must clean it up, and we provide them with a tax credit and some help to do that. So this is a very important step forward in dealing with what is, again, a totally preventable childhood tragedy. And we're going to have testimony today from some of the families who've dealt with childhood lead poisoning, and we're going to hear from some of the other authors of 4 bills that we have dealing with lead disclosure and assistance with our lead hazard problems in Minnesota. So let me just say that I have not been able to get a hearing on this bill. I was told a couple days ago by the chair of the committee that if a Republican had been carrying the bill, maybe it would have got a hearing. I'm very frustrated. This is, again, a very important public health issue here in the state of Minnesota. Our health department has done a report, and you'll be hearing some of the details of that as we go forward. So let me just start this by saying that you will hear from a couple other legislators about the bills that they are trying to get hearings on as well. I was inspired to bring this bill forward by my constituent. And I would like her to just tell you a little bit about her story first, and then we will hear from the other legislators. And I want to thank my Senate author. Did you want to say something first, Senator Huffman?
Absolutely. You said everything that needs to be said. One of the things about this is that it allows people to, it's kind of a right to know piece, and you get knowing that the 700 children a year in Minnesota that are exposed to this, it's long-term care. You're looking at increased special education and related services costs, and we can actually prevent that, which is a long-term savings. And hopefully, knowing the 3,000 bills that have been dropped this year, that this one we can get a hearing either in the House or in the Senate on that, and I think there's a few people here that will help us get that going. But thank you for bringing this bill forward. And
thank you.
Senator Abler.
Senator Abler, well. I'm pleased that you're here as well. Maybe you can get a hearing in the Senate. We'll be glad to be second in the House. I just want to make sure that we can bring this forward. So I'd like to introduce Tycia Fletcher, who will tell you about her personal story, and it's in honor of her son that we have named the House file before you. I'll let her talk right now. Tycia?
Good morning. First of all, I want to thank all of the authors and my chief authors for signing the bill and supporting me on this issue. In 2010, both my children were poisoned by lead. My son, Dustin Luke, has been permanently disabled from lead poisoning. Today he's diagnosed with autism, and now he's developed some emotional behaviors and all kind of other things that we haven't even been able to give a title to the issues. I just want to say that I think this is a very important bill because, not just because of my son, but because of all of the children in the state of Minnesota. The children are our future, and they're going to end up becoming adults. And we need to make sure that they're healthy and they're well to be able to maintain in his life. Dustin struggles every day. Today, he's not even in public school. They discharged him from school. We're looking to homeschool him now, which leaves me to be at home every day. I'm a college graduate. I deserve to work and pay back my student loans, and I can't do that because I have to take care of my son who was born normal at birth. He got poisoned in 2010, as I said, in an apartment building in South Minneapolis. It was no fault of my own. I never knew what lead poisoning was, but I think I got a PhD in it right now today. I just think we need to just look a little deeper into what we're passing and what we're not even giving hearings to. Lead poisoning is very dangerous. Kids come up with mental disabilities, learning disabilities. My son was severely bow-legged. He just learned how to talk last year. He's 9 years old today. And his teeth, normally kids' teeth come out about 4 or 5 years old. His teeth just started to come out. So he has a lot of physical and mental issues that's going on in his young life. But I thank God for just the little changes that he's made in his life thus far. I'm asking the state to look at the bill and to consider a hearing. Dustin is not the only child that has been poisoned. This poison is not just a black issue. It's every nationality. It hits every home. Black, white, Hispanic, Asian, Hmong, every nationality that we have on this earth, it can affect. So I don't want you to just think that I'm standing here fighting for my son. I'm fighting for all of the kids in the state of Minnesota. When we first found out, we had no support. Today, I am the founder of Minneapolis Parents for Lead Safe Kids. I support the families who don't have anyone to turn to. I didn't have anybody to turn to. Once I found out, that was it. I got evicted from my apartment. But now, there's help for families. I'm here to help them walk through whatever issues that they may have. I'm just, like I said, I'm just asking for a hearing just so we can at least set something in place for the state of Minnesota. We don't want to become a Flint. We don't want to be on national TV like that, looking bad, when we can change it. It's just a matter of a vote. We can change it, and things can be better for our kids. Thank you.
Hello, everyone. My name is Rochelle Menentopaleska, and I'm the Director of Education and Outreach Department at Sustainable Resources Center, which is a nonprofit organization dedicated to advancing the cause of healthy housing. I'm happy to be here to testify in support of this legislation because it will provide vital information about disclosure to families and communities that will keep them healthy and safe. Keeping kids healthy and safe is something that SRC values and supports. Our mission is to partner with families and communities to create healthy, energy efficient, and safe housing environments. And our primary programs include low-income weatherization, training, lead poisoning prevention, and lead hazard control. As research has known, many of you know, lead poisoning has many harmful effects on children's intelligence, behavior, and growth. And unfortunately, many families are not aware of the problem, the sources, and the consequences. Thankfully, lead poisoning is preventable. Through our education and outreach programs, we offer in-home visits to identify lead hazards and collect dust wipe samples, assist families into enrolling into different programs that are out there through Hennepin County, City of Minneapolis, and the Minnesota Department of Health. This past year, our educational staff offered 230 in-home visits to high-risk neighborhoods to prevent lead poisoning prevention. Furthermore, the only way to know that a child is lead poisoned is to receive a lead test, which we also offer through our screening events. We've tested 440 children under 6 years old and identified 40 children this past year who had elevated blood lead levels, which is 5 or above, 5 micrograms per deciliter or above. SRC has been a partner with many successful and long-standing prevention programs. During my 9 years at a Sustainable Resources Center, I have seen many children suffering from these devastating effects of lead poisoning. Single-family homes, as well as rental units that were built before 1978, have the greatest risk. I'm currently working with families right now in a multi-unit apartment complex in South Minneapolis, where at least 3 children have been poisoned. Under much pressure, the landlord is now cooperating and working with the City of Minneapolis's lead hazard grant program. It is critical that families know the truth about lead disclosure. With the Dustin-Luke Shields Act, landlords will be made accountable in providing clear and concise answers to renters to whether there is lead or not, or no lead on the property. This bill will provide families with important information about the housing that they are going to be living in so that they can make informed decisions, increase their awareness, and most importantly, prevent the long-term health effects from lead poisoning. There are a lot of things in this world that we cannot control. Lead poisoning is not one of those. We have the opportunity to do something and to keep our children and families safe from lead. When given this opportunity, we hope that you will agree with me and support this bill. Thank you.
Hello, everyone. My name is Amanda Kappas, and I'm the Legislative Director for MICA. MICA is the Metropolitan Interfaith Council on Affordable Housing. We are an advocacy group that works on housing issues and transportation, livable wages, and good schools. One of the main reports that we are looking for as far as research for this bill that we've taken a lot of our research and statistics from is from the Minnesota Department of Health. It's the economic burden of the environment of two childhood diseases, asthma and lead poisoning in Minnesota. And this report was just written in December of 2014. According to this report, when they looked at a range of children at from 2 to 6, they figured that the children that were lead poisoned during that time at 2014 wages, about 700 children per year, it cost the state of Minnesota a loss of wages, people paying taxes to support our state, of $1.9 billion. That's not million, that is billion with a B. So you bring in the loss of wages, you bring in the special ed costs that were spoke about by our legislators, the PCA services, increased medical costs. And unfortunately, in the Star Tribune last week, there was a report saying that if we go to block grants from the federal government, Minnesota is looking at losing $5 billion of Medicaid services. Now, when we look at where lead is, it's mostly in lower income housing. So what that means is if you're in lower income housing, more than likely you are eligible for Medicaid funds. So if we don't address this problem, what is going to happen is it's going to be a much greater cost to our state versus than changing a law on a very preventable disease. Thank you.
Hi, my name is Amy Waller. I'm a public health registered nurse. I work for Minnesota Visiting Nurse Agency, which is part of Hennepin County Medical Center. I do home visits for children with families that have been affected by lead poisoning. In my experience, I see dozens of families every year. In my experience, it's rare that families were knowledgeable about the risks of this before they were diagnosed. And this bill is so important because, as everybody else has illustrated, this can be prevented. And I know that every single family I work with would have rather prevented this than dealing with it afterward. So once a child is lead poisoning, they're already at risk for having future problems. No matter what the level is, there's no safe level of lead. And while there's numerous sources of lead in the environment, the biggest one by far is older homes with lead paint. And so that's why it's so important that people who move into rentals or choose to buy a home have the right to know whether there's lead paint present and are educated on the risks of living in a home with the lead paint. Most of the time, children don't show any signs or symptoms once they have lead poisoning initially, and as someone else mentioned, the only way we usually find out is by routine screening. Most of the time, parents have a hard time believing that something could happen to their child who's lead poisoned because at the time they appear to be smart and advanced, and usually the effects don't show up until years later. And as everyone mentioned, the problems can include developmental delay, problems with behavior, speech delay, ability to learn, in hearing and vision, anything that your brain, functions can be affected by lead poisoning. The problem is that children that are most susceptible to getting lead poisoning are at a really critical stage in their brain development. So younger children are at a lot greater risk, and as everyone else mentioned, low-income families are at a much higher risk for this as well. Babies also who are unborn, pregnant women are at a high risk as well, and pregnant women are rarely screened for this. Babies who are poisoned before birth can have problems with premature birth, lower birth weight, and slower rate of growth. Frequently, families initiate projects in their homes without knowing the risks of, doing projects in a home with lead paint. And people who sign leases with homes that have lead paint have no idea what this could mean, and they have no idea that, the problems that the child could have in the future. They're just, doing what's best for their children. Most of the parents are totally devastated and, very worried when they find out their child has been lead poisoned. And I know you can all agree that we could really do a lot more to prevent this. So I really hope that everyone can help support this bill and, get some prevention in place. Thank you.
I thank all of you. I'm State Representative Raymond Dean. I represent District 59B, which is most of downtown and the southern part of North Minneapolis. And I want to talk a little bit about House File 2181. And I brought this forward because it requires us to begin testing our schools and our licensed daycare facilities. It don't include group or family daycare centers, but really those licensed facilities to test the water. Kids spend a lot of time at their home. They also spend a lot of time at their schools. And we don't know what some of those schools have as far as their water quality and what are the levels of lead in the actual water the kids are drinking throughout the day in their schools. So I think it's imperative that we begin to do that. I'm a little shocked that we haven't done that. And it asks the Commissioner of Education and the Commissioner of Health to actually develop a program that would not only facilitate the testing, but also then begin to address how we address that. And other bills that have been introduced throughout the United States have a sort of a date on when a school was built before it requires the testing. My bill does not, and one of the reasons that it does not is in today's day and age, we have construction materials that are coming to Minnesota from throughout the world. In some new building materials, it's been learned that some products that have come from places like China or other areas that are used in our water system are actually introducing lead into the water system. So even if a school was built in 2016 with modern building techniques, there's still the possibility that lead may exist in the water. And we need to find out those schools and those daycare centers where that exists, and we need to change it so we don't continue to poison our kids. So thank you.
Hi, I'm Jean Wigginez, representing part of South Minneapolis and part of Richfield. And I'm going to talk to you about House File 355, and I'm the chief author of that. And basically, every medical professional will tell you that a child should have 0 blood in their body. Yet, our state rule done by our Department of Health says it will be 5 parts per million before we intervene. What the bill does is say, no, it should be 0. Let's not put the burden on the children. The burden should be on us, on adults, to help prevent lead poisoning in children. We don't need a bill. The Department of Health, the commissioner, can change the level at his will. And the bill is just to say, get it done.
I'm Representative Jamie Becker-Finn, and I'm the chief author of House File 1356. 1356 addresses exposure to lead in a little bit different issue than different method than we usually talk about. So my bill would eliminate the use of lead ammunition in deer hunting, and that's because lead basically dissipates into something that you shoot with a lead bullet, and so we are risking the health of our kids by exposing them to lead through consumption of venison, something that we typically think of as a very healthy thing to eat. I'm a mom, I'm a deer hunter, and it's something I care really strongly about. So in addition to just getting lead out of our environment, it would prevent exposure to lead through consumption through venison.
Thank you. That's our testimony today on the bills, and if you have any questions, we'd be glad to try to answer any of the authors that are here as well.
Approximately 700 reported cases per year. Unfortunately, the state of Minnesota does not have universal testing throughout the state. So we acknowledge that there is more than likely many more children that are being missed. And because of the lead poisoning happening in their bodies, symptoms may occur later on It may dissipate in their blood by that time. The numbers could be quite larger just because of the way things come up. Another thing I wanted to show you is at your local big box stores, you can purchase these lead test swabs. They cost approximately $8, and all you do is wipe them over a windowsill, an old porch floor, any ceiling that may be painted, and if it turns red, it's lead. So this is a good start for people if they're concerned about their home, that for $8 you can have that tested, and then we can assist you with researching out to groups that can assist you with removing that. Another kit to test your water is about $22, and this will walk you through it. It's about a 20-minute test, and you'll have the answer again to see if there's water in your pipes at your home. So lead in the water. Sorry. Lead in your water in your home. Sorry about that. So for under $30, you can test your paint and you can test your water in your home. And again, you can pick these up at any big box hardware store. There's approximately 359,000 renter-occupied units in the state of Minnesota that have potential lead hazards in them currently.
I think one thing that wasn't mentioned, but only briefly, is this is a racial disparity issue as well as a low-income housing issue. But I can tell you anyone can have the problem of lead poisoning if their home was built before 1978. And that's one of the reasons that, this should concern all Minnesotans, and one of the reasons we should have a hearing on these bills. This can affect anyone of any income level if they live in a home where there's this type of exposure, and also if they live near busy streets where their soil may be contaminated from lead prior to the time that lead was taken out of gasoline. And now we know, because of what happened in Flint, that we need to pay attention to the water. So this bill does, for the first time, my bill 491, also say that the property owner should test the water. And that is an additional assistance to the person who will be residing in that property. Again, any questions? Comments? If not, well, thank you so much. We hope to get a hearing, and as soon as we get one, or two, or three, or four to each of these bills, we will certainly alert the media. Thank you so much for coming.